I am Alma Ponce. I am the Regional Outreach Coordinator for the Southeast region of the state. So far in the bottom corner, I serve both Malheur, Grant, Baker, and Harney counties. So really happy to be here and support the work. And I will give it over to our colleague Yesenia.
Hello, everyone. My name is Yesenia. I'm one of the Regional Outreach Coordinators from the South region. We serve Blake, Klamath, Jackson, and Josephine counties. It's an honor to be here. Welcome, everyone. So, yeah. And
thank you, Yesenia. And we will go ahead and turn it over to Lori.
Good afternoon, everyone. Thank you for having me here. I'm the senior Medicaid Policy Advisor for the Oregon Health Authority. Some of you may remember me from other community partner meetings we had. I believe they were last fall or spring. I can't remember.
I know, right?
But we really appreciated all of the input that we received in those last, and today I'm here to give you an update of where we are. I think I have some really exciting news to share, but I will say we're right in the middle of our final negotiations with our federal partners. So we'll talk a little bit about that coming up. So happy to be here.
Thank you so much, Lori.
Oh, great. And Ruby, you just tell me when it's time for me to chime back in.
Yes. So we will definitely keep you posted. If we have questions coming up, we're definitely going to turn to you, Lori. Really appreciate you being here. Thank you so much and welcome. And I did hit the record button, so I just want to make sure everybody is aware that we are recording today. So if you're curious if you'll get a follow-up video, we will make sure to make that available, or if your colleagues were unable to be here with us today, we can make sure to get that video out to them. And Yesenia, can you or Alma think of any other just housekeeping reminders or anything? I guess I should mention that we don't have an interpreter today because this meeting is, we didn't get any requests for an interpreter. And we actually decided to go ahead and honor the request we've gotten to hold meetings in Spanish only for our Spanish speaking community partners. So if you prefer to get this update in Spanish, you can also join us tomorrow afternoon. We will be here from 3 to 5, and I have all that information for you. If you didn't receive that invitation, let us know in the chat and I can go ahead and forward that to you. Thank you. I'm just going to go ahead and look in the chat here as we're moving into the next slide, because we're going to need to keep a good close eye on that chat. So Yesenia, you can advance over to the next slide. Thank you. Okay, so I know we've met a lot of you in the previous Medicaid waiver meetings, but there's probably going to be new people here today. So we'd love to hear more from you. We do have a large group, so unfortunately we don't have the time to go through and do verbal introductions, but we'd love to invite you to do an introduction through the Zoom chat. So if you could share your name and pronouns optional and the organization you work for or volunteer for. And we would so appreciate that, just to kind of get a good idea of who is in the room with us today. We also want to run a poll, and I think this is a good time for us to do that. So I'm going to go ahead and launch our poll. So what we'd like to know is, we want to know if this is your first time joining an 1115 Medicaid waiver meeting, yes or no, or maybe you're not really sure what we're talking about, and that's okay. You know, what we've learned in the last few months is that, you know, a lot of community partners are still learning what the 1115 Medicaid waiver is, and in fact, members of our team are still learning what the Medicaid waiver is. And really, we've been focusing on just kind of making sure we're having ongoing conversations and continuing to get involved. So don't be shy. If you have no idea what we're talking about, let us know. This just kind of helps us gauge and understand our audience. Another thing I wanted to go ahead and ask is if you're comfortable sharing, are you a member of the Oregon Health Plan? So I'm going to give you all a minute or two, and I can actually see your results here as people are clicking in the buttons, but I will give you just a moment to go ahead and make your selection.
When you're asked if we're a part of the Oregon Health Plan, does that mean that we are sisters?
That's a great question. So are you enrolled in the Oregon Health Plan? So, you know, are you enrolled in like open card fee for service or CCO? And when you're scheduling doctor's appointments and they ask you what type of health coverage you have, if you have the Oregon Health Plan, and if you feel comfortable sharing, just let us know.
Thank you.
You're welcome. Okay, so just so you can get an idea, it looks like, wow, we have a lot of new people in today's meeting. This is really surprising. I know our last meeting was during the holidays, and you know there was a meeting before that that was around the time of maybe spring break or something like that, or around the time the sun comes out and people are just taking time off. So it looks like 71% of you are participating in this meeting for the very first time. So that would mean that only about a quarter of you. Yeah, wow. That's very surprising. So about a quarter of you have participated in previous meetings, but most of you are new. And it looks like 2 of you are not sure what the 1115 Medicaid waiver is. So that's okay. We're going to be talking about the basics of the Medicaid waiver as a refresher. Are you a member of the Oregon Health Plan? 33% of you are members of the Oregon Health Plan, and about 67% of you are not. All right, so that's it for our poll questions today. Thank you so much. All right, next slide, please.
All right, thank you very much, Ruby. So now we're gonna start off with what's Medicaid and what's the Oregon Health Plan. And as we can see, some of you might be familiar with these definitions, but some of you might not. So let's review some basic information so we're all on the same page. So Medicaid is a state federal partnership that provides health insurance to mostly under-income families and individuals, and also for other reasons such as disabilities. The federal state joint program is mainly funded by the federal government. The federal funds about 75% and the state funds about 25% of this program. And unlike Medicare, which is completely managed by the federal government, Medicaid looks different state by state, even though we still need to comply with the federal, with what the federal requires. Our Medicaid here in the state of Oregon is called the Oregon Health Plan, and also known as OHP. Our Medicaid was renamed back in the 90s when it went through some major reforms to improve the program. And then about 11 years ago, it went through some other major reforms in which we changed the delivery and access system. And we launched the CCOs, also known as Coordinator Care Organizations, which are local entities that manage the health coverage of the OHP members, and they cover medical, dental, mental, and behavioral healthcare. Around this time, the Affordable Care Plan passed and the enrollment actually increased. And nowadays, 1 in 4 Oregonians receive their medical care through the Oregon Health Plan. All right, now what is a waiver? As I mentioned before, the federal government lays out the requirements for the Medicaid federal partnership, but all the 50 states can ask the federal government to waive some of the federal rules, and that way we can innovate according to the needs of our communities. the federal government has a process in which the state can waive some of the federal requirements to test a new model, which pretty much is a way to test how we can provide medical benefits. The idea behind this is that all the 50 states are innovating, and we can all learn from one another, and we can continue to find ways to provide care. And also, when states find a better way of doing something, the federal government can actually make it permanent. This process happens every year. Every 5 years. So this is the definition of the waiver in this case. The waiver does not define the entire program, but it does give flexibility where otherwise we could not be able to do certain things under the federal law. I do want to emphasize that the waiver cannot waive all the requirements, but it can waive some of the eligibility requirements, such as who is covered or how services are paid for. There are 7 rules that can be waived. And in this agreement between the state and the federal, the goal is to offer high quality care and that the program does not cost more than what it already costs. Part of this process is that the state will request which rule wants to waive, also known as a proposal, and then the federal will decide whether to waive it or not. I also want to mention that the Oregon's first waiver was in 1994, which was about 26 years ago, and that every 5 years, Oregon must renew its agreement with the federal government. Now, what is the 1115 Medicaid waiver? Like I said before, the federal government can either accept or reject a waiver proposal. But there is a waiver called the 1115 demonstration, which is the broadest type of waiver available under Medicaid. Under 1115, the state may propose waive many of the key provisions of the Medicaid, including, but not limited to, who is covered, what benefits are provided, how much individuals may be charged for cost sharing, how providers will be paid, and it will also need to include a formal evaluation of impact, which means that the state needs to build a measure reflecting how the quality and access was improved over a 5-year period. And now I'll pass it to Alma, right?
Yes, thank you, Yesenia.
Okay, thank you.
Alrighty, so it is important to know that the waiver is not the only way that we can change how care is delivered or improve the experience for members in the Oregon Health Plan. The waiver is specific to those things where we want to think outside of the box, where those items that are originally included in the framework. Ways to change how care is delivered are by making changes to Oregon law, Oregon administrative rules, or updating and changing CCO contracts. Medicaid waivers are not for fixing all parts of the healthcare system, as not all the services are covered under the waiver. Community partners are still asked to continue to advocate based on community feedback for those needs that are not initially included in the waiver. That waivers cover home and community-based services for specific populations. State plan amendments are for specific services, and provider types have different CMS approval processes. Medicaid waivers are not for filing a complaint about a specific provider or service. A way to report any grievances or complaints are directly through CCOs and healthcare providers. And then next slide, please. So let's look at the timeline process of the waiver and the progress that we've made. So some of the work in process that you all may have been involved with was back in early November and December of 2021, where we submitted the concept papers and held sessions for public comment, where we collected feedback. Then in January of 2022, this year, we incorporated that feedback and later submitted the waiver application in February of 2022. Shortly after, between March and April 13th, the waiver was opened up for federal comment via the CMS website. During the time between April and June, there's also been a period of implementation planning and negotiations with the Center for Medicare and Medicaid Services. On June 8th of 2022 this year, CMS confirmed an extension of the current waiver to September 30th. Right now, we are still in negotiations and implementation planning with CMS and anticipate to have approval by September 30th. OHA will have 6 months after the approval to complete the implementation planning, although some changes may go into effect sooner. Any resulting changes to CCO contracts will occur during regular annual reinstatement or at the 5-year procurement, deeming whatever is appropriate. And then next slide, please. Our primary overarching goal for the waiver is to advance health equity, which combines well with the Oregon Health Authority's strategic goal of eliminating the health inequities in Oregon by 2030. Having a framework in place is really important as we continue to move forward in our work to eliminate the health disparities in Oregon. In the first box with the umbrella that's a key sub goal that we are focusing on. We're looking at expanding access in 2 areas that we have been having conversations about. One is expanding coverage for children from age 0 to 6. So once they are on the Oregon Health Plan and receiving benefits, they wouldn't have the need to reapply or go through the redetermination process all the way up until their 6th birthday. This allows for continuity of care for those young children across those important early years of their life. The other part to this goal consists of individuals who are age 6 and older, not having to go through the redetermination process for 2 years versus the 1 year, which we currently have in place. This again will allow for continuous coverage for those age 6 all the way through adults. And in the next box, you'll see the improving health outcomes by streamlining transition really has 2 big focus areas in the waiver. One is expanding what the federal government will pay for, or at least provide for social determinants of health as related to the work that we've been currently doing with health related services that our local CACs are primarily involved in. Another piece is that those services would be focused on the individuals who are in a current state of transition. It could be those who have been in criminal justice services, foster children, Oregon State hospitals, older adults who are making the transition from Medicaid and to Medicare. Next is the green box, encouraging smart, flexible spending. We are looking at flexible spending or expanding health equity and making it more about encouraging CCOs who are our coordinated care organizations to spend the dollars on health equity and social needs and other areas of care that help keep people healthy and not just focusing on the payment for the medical related services that are being given. Lastly is our blue box focused on the health equity investments. The focus is on creating some health equity investment opportunities and putting money into those communities for the people who understand what those drivers and needs are directly in the communities to help improve health equity, giving them the power to make the decisions along with the resources and funding to make those things happen. And then next slide. And I believe Ruby, you're on.
Thank you, Alma. All right. Well, I just want to check in and see if we have questions, and it looks like we don't so far. So I just want to invite you to add any questions or thoughts you're having into our chat box. And Yesenia or Alma will wave me down and we can pause and make sure we address your question as we go. We wanted to do it this way so that people aren't forgetting what their questions are and we're not leaving them until the very end. That said, we will have some time at the end to answer questions. So just make sure you write down what that is if you prefer to leave it for the end, and maybe make note of the slide number so we can refer back to it. So for those of you who participated in the Medicaid waiver meetings prior to today's meeting, here are some changes from the draft to the final application. So all pharmacy requests have been removed. We received a lot of feedback on a closed formulary and removed our request for that closed formulary. We learned we didn't really, it sounded like we didn't really need a waiver for this, or we did need a waiver for this, but we weren't really getting what we thought we'd get from advocates. So what we heard loud and clear is that this needed to be removed. And so that did go ahead and take place. Another item we removed is really the idea of people who apply for SNAP benefits. We were going to look at OHA easily enrolling people in OHP if they qualify. And basically, we got an idea from CMS to look at a different pathway. So it's something we're going to circle back on, probably after we address redeterminations. And that will be something to look at really around the time our public health emergency is ending or wrapping up. So stay tuned for updates on that. And so this might be an area where I might need a little bit of Lori to chime in here. So I believe we removed the EPSDT waiver. Wow, that is a mouthful, which stands for Early Prevention Screening Diagnosis Treatment. And this outlines benefits for youth and children under age 21 to expand access to care. So my understanding is that this is a federal requirement waiver that Medicaid provides all medically necessary services for kids 18 and under. And we've had a waiver tied to our prioritized list, and that waiver is going away with our next renewal. But I would love to hear more from Lori, if you could chime in on that a little bit.
Here. Darn it, I can't get my camera on. There you go. Yeah, I'm happy to. So it is a mouthful, and what it means, I guess, is that for a long time, we in our waiver, we were able to waive federal rule around early prevention, screening, diagnosis, and treatment for kids. And so there's a federal rule that says that for every person on Medicaid, so in Oregon, that would be Oregon Health Plan, individuals who are under 21 and under can have a right to have all the services that a doctor says are medically appropriate, regardless of whether they're covered or not by a health plan, by the Medicaid plan. In Oregon, we had that for babies 0 to age 1, and then up to age 21, we had this waiver that allowed us to cover the benefits for youth and children that doctors deemed medically necessary that were also on the prioritized list. And that defines our Medicaid plan. So we're no longer going to have that waiver, which means that now we will be like all the other states, where we will be covering any medically necessary services for kids on the Oregon Health Plan. And that's going to start January 1st, 2023. So it expands a few services. I mean, to be honest, we were providing most all services that kids need. There were a few things that were not normally covered that some children had a hard time receiving. And so that's why we're removing the waiver. Is that helpful, Ruby?
Yes, thank you. All right.
And I do want to mention that there is a question in the chat box, and it says, is there any way to get a 3-month supply of chronic health meds needs? All right, needs. And I just want to make sure that you know about it.
Okay, it's from Sandy Waters. I think I see it here, like the 3-month supply of chronic health prescription needs. Sandy, will you tell us a little bit more about that? Okay, so who determines what is medically necessary? Is that their primary care provider or someone at the CCO? Is this
That's their provider, their primary care provider, or their pediatrician, yeah.
So this wouldn't have to go through an additional review at utilization management?
There may be, to be honest, we're still working on what that's going to look like, but it won't, so there may still be prior authorizations for some services, and so those rules, For EPSDT, you can still require a prior authorization. So the doctor can say this is needed for the child, and then they need to contact the CCO to get approval. So that can still happen, but yeah.
Thanks.
Thank you. And I think so what Sandy was referring to is people in rural areas are they're having a hard time getting to a pharmacy, and having a 3-month supply would be helpful. And if that's, where do partners go with that feedback, and how do they make that happen? Is that really more of something, partners should be working with the CCO on, or is there a rule that doesn't allow CCOs to provide 3-month supplies, Lori?
I don't know enough detail, but the first place to go is to work with their CCO.
Going to say work with your CCO, because I do know there are some that allow for a 3-month benefit or a 3-month supply of certain medications. So if they're enrolled in a coordinated care organization, that would be the first place to check.
You're welcome, Sandy. Okay, thank you for adding those questions to the chat. Really appreciate that. All right, Yesenia, you can advance to the next slide.
Yes, there's one more question. Can you please remind us what CMS stands for?
So Center for Medicaid and Medicare Services, is that right? But I've never understood why there's only one M.
That's a good question. One of the things is CMS is, the Center for Medicaid and Medicare Services. And when we talk about the Medicaid, and then there's 2 branches, and Medicaid is for low income folks. Medicare is for people 65 and older. So there's 2 different branches, and the Medicaid part is actually called CMCS, which stands for the Center for Medicaid and CHIP Services. And CHIP services are allow more kids to get Medicaid and more kids to be on the Oregon Health Plan. So that's how it goes. And I don't know, Ruby, I have always wondered too why it's called CMS, but it's Medicaid and Medicare. So that remains a mystery.
It's a mystery. If anybody figures that out, let us know. Okay, did we get all those questions, Yesenia?
Yes, I think we did. I don't see any other questions. Thank you so much.
Thank you. Next slide, please. All right, so this is really the meat and potatoes, I would say, is the update of what exactly, where we are and how things have changed. And, there's a lot to cover today on this slide. So I will definitely tap into you, Lori, if I get stuck here.
Okay.
But I think, the biggest update is really, or the biggest updates are really on this slide. And my understanding for social determinants of health benefit packages is that we had requested 4 packages: 1 housing, 2 food assistance, 3 transportation, and 4 employment. And my understanding is that employment is off the table due to lack of, capacity to really work through the benefit. And transportation, it looks like we can come back to that after September. Is that correct?
So yes, what we are anticipating having approved at the end of the month is housing services and nutrition services. And then the employment and transportation, we may take up later, but that's we don't have approval. We won't have approval. I know we won't have approval for transportation and employment supports.
Got it. Thank you for clarifying.
Yep.
And I think it's been probably about 10 years that I've heard from a lot of community partners around how to support justice involved community. It's been, just tireless efforts of people really wanting to transform that. So for those of you who have been curious about justice involved requests, those will take place sometime after September 30th. And my understanding is that CMS is going to be planning to issue guidance for all states, hopefully by the end of the year. For youth with special healthcare needs, we've done a lot of work around this group so they can have coverage up until their age of 26 under a specific eligibility category. And this group would be eligible for approved social determinant of health benefit packages and also have coverage equivalent to early periodic screening, diagnosis, and treatment, which is a requirement for youth until age 21, and we would extend that to 26. And I will be talking about that here a little bit more in just a moment. Continuous enrollment and coverage expansion. So this is something that Alma had actually touched on a little bit earlier, and we're feeling pretty good about the request we've made to CMS, both the 6-year continuous enrollment for children from birth to 6th birthday and 2 years of continuous coverage for everyone over the age of 6. For peer-delivered services and community health workers, we learned that we don't really need to work through our Medicaid waiver for these requests. And so we're looking at what we can do a little bit later. So just stay tuned for more updates on that request. Community investment collaboratives. So this has been really exciting. There's been a lot of conversations around community investment collaboratives. Our community partners have just kind of been on the edge of their seat, wondering what is going on and partnering with their regional health equity coalitions. So we want you to know that we will continue to work with our regional health equity coalitions in how we respond to CMS. And we've heard loud and clear from CMS that they very much value this approach, and this is a very strong approach. So we will continue to ensure that the efforts are community driven and really focus on health equity. So for early periodic screening, diagnosis and treatment, and prioritized lists, that is, like I said earlier, a mouthful. So this will be implemented for all youth in Oregon starting January 2023, is my understanding. And we are discussing the prioritized list as mentioned earlier and whether it's time to process out of the waiver and into a more long-standing approach. So I think by now, Yesenia had touched on this earlier, really the goal of a Medicaid 1115 waiver is to demonstrate ideas and share with other states. And at this point, we've kind of reached the time where we have demonstrated the prioritized list as being effective. And we're looking at really moving this to a more solidified plan, a state plan amendment. So stay tuned for more on that. For tribal requests, so we have a few tribal partners in our meeting today. We want you to know we will be addressing tribal requests during the post-approval process along with other items. So just make sure you're aware that after September 30th, we have 120 days for post-approval, and we will continue to work on some of that work some of the work we're not completing by September 30th. So if there's anything that's sort of kind of in the gray zone that we just kind of need to pause on, know that that work is coming. And for designated state health programs, you may have heard of this. People do refer to it as DSHP apparently, where we come up with all these acronyms. I'm not sure. We should like create a board game or something and see if we can guess who actually wins here. It's getting pretty complex, isn't it? So this is really a mechanism for the federal government to provide additional funding for states. And we did request DSHP. In the prior administration, my understanding is that CMS was not entertaining this approach. And since then, there's been a lot of internal discussions at CMS levels to really change direction and move this forward. And it sounds like things are looking pretty good. My understanding is that if this is funded, we would have the opportunity to support all these exciting social determinant of health related programs for members that are in transition and really, come out strong with our community investment collaboratives. So these are the collaboratives that are going to be focused on those community driven health equity improvements. And if DSHP is approved, there will be more limits in the past than there has been in the past. So that's something we need to really prepare for and look at mindfully. So if you're curious what those limits could look like, or those parameters could look like, those are things, the things that are changing are, how much our state gets in terms of funding, and then what contributions from the state will be paired with the programs we are proposing. Essentially, CMS doesn't really want us to look at this funding as a way to fill budget gaps, but really look at being innovative, thinking outside the box, and focusing our energy on social determinants of health for members that are in transition and for community investment collaboratives. Lori, do you have anything you'd like to add about DSHB?
I don't think so. I think you covered it really well.
I know that one covers quite a bit, so I just wanted to be sure. I did want you to actually expand a little bit on managed care rates. If you could do that for me, please.
Yeah, I don't have too much to say. Managed care rates are what we pay how we pay our CCOs, or our coordinated care organizations, to cover the health services for members of the Oregon Health Plan. And so we had some discussions with the federal government about those rates. So for example, I think one piece that's really kind of wonky but exciting is that these social determinants of health benefit packages, so housing supports and services, short-term rental assistance for certain individuals, nutrition services, so food boxes, for example, or medically tailored meals, can be paid for with like a Medicaid, like a doctor's visit. Same thing. And so, and this is the first time in the country that's ever been allowed. So we're paying for social determinants of health. I guess I'd like to just short it to housing and nutrition services that help people obtain housing and keep that housing as really a medical expense, because with the idea that, a person can't be healthy if they don't have a place to live. So, so we've talked about how those payments happen, but the important piece is that this allows the CCOs to make those payments to, providers who help people find their housing and all, just like they would pay a primary care doctor or another, a physical therapist or somebody in the medical system. I see a question here that says, how do customers access that? And so it's not through a CCO Flex Fund. These housing and nutrition services will be an actual, like a benefit. So meaning, if you need to go to your primary care doctor, that's a benefit for that, to have your child have a well child visit. This would be a benefit. I do want to say that the housing services and the nutrition services are only for people who are in transition, really big life transitions or life changes. And so they would be for people leaving criminal justice system, people who are homeless or at risk of becoming homeless, kids who are leaving foster care, youth with special health care needs, and elderly people who are moving from having Medicaid to Medicaid and Medicare. So it will be, it's not all members can have access to the services. And we are going to be taking the whole year of 2023 to work with providers, work with the CCOs and our members to figure out how this whole process will work, because it's all new. So the services will be available for people starting in 2024.
Thank you, Lori. There was a question that I did answer, and I don't know if you have anything to add, Lori, is if communities don't have a regional health equity coalition, how do they stay involved in the CIC work?
That is a really good question. I don't have a great answer right now. What's happened with the CIC work is the Center for Medicaid, the federal Medicaid program we weren't able to reach an agreement with them on the CICs yet. So when we get approval for our waiver at the end of the month, that in our approval letter, it's going to say we support the idea of CICs. We didn't, we're going to continue to work with Oregon on them. So I think what we're going to have to do is regroup, take a look again at, how we're going to move that work forward across the fall and early into next year. I think, Ruby, maybe this is something that we can talk about in terms, meaning internally, to make sure that we're providing information through like community partner meetings and other ways just on what's happening with the CICs. So that's what I have for you. We did have a meeting with the community advisory councils with CCOs. I met with them a couple weeks ago, and we will be meeting with them again. So I think, we're hoping across October in particular to meet with lots of community partners to get feedback and input, and we'll discuss how to make sure that, all parts of the state, even if they don't have a regional health equity coalition, can provide input. So great question.
Thank you. And yes, we are always happy at the OHA Community Partner Outreach Program to move message and share any opportunities, whether decisions are being made or meetings are taking place. So we will keep you all in the loop. We do have a list of the people who were here today when you registered for this meeting. So you will be added to our distribution list of anything related to our waiver. And that goes along with social determinants of health and different CIC initiatives that are taking place. All right, next slide. So because we have a lot of you here today, most of you actually who are attending this Medicaid waiver meeting for the first time, which I'm still surprised about, and I'm really happy that we're getting new people involved in the process. This is really exciting. Know that we began collecting stakeholder input and really looking at that February through June of 2021. And what we did is we took that input that was captured and that was shared through a stakeholder input report. That information was then utilized to create our strategies or concept papers we'd be presenting to CMS. And we received feedback around the concept papers after sharing them in our community engagement meetings. So that information was then fed over into our stakeholder input report. And from there, we started drafting the waiver application. So we've been really capturing your input step by step. This is our 4th meeting with community partners, and we do have a list of all the previous meetings along with videos if you'd like to sort through them and listen in. We invite you to reach out to us, and we're happy to share those videos. And where we are now is really negotiating with CMS, as mentioned a few times in our meeting. So we've submitted the application, and we're really just kind of hanging tight, and we will be keeping you posted on some of our final approvals. Next slide, please. So we've talked quite a bit about the negotiations we've had with CMS. We've really focused our energy on, spending all the time negotiating with CMS via community partner engagement and different work groups. And just know that as we reach out during the post-approval period, we will continue to expand and collect your input as we're building a plan for implementation. We will be sure to describe here in the near future what does get approved, and we'll be sure to update you on changes and anything that did not get approved. Something to just be prepared for is that the waiver is really kind of high level, specifically the 1115 waiver, and we can waive federal requirements, and the details really happen during the post-approval period and implementation planning. I know we had a lot of community partners and OHA staff members who reached out to me, and we're kind of thought like, okay, this is the one time I can provide input, and then my opportunity is gone. But just know that there are going to be, you know, a lot of opportunities to really include you in the implementation planning where the action's really taking place. So very exciting. And so most of this action will be taking place towards the end of 2023 and even 2024. Know that there's a process to connect with you and continue to offer public forums and really, like I said earlier, be robust in how we're engaging you and including you in implementation. Thank you, Yesenia. All right, well, we want to check in with you and see if you have any questions on today's update. So if you'd like, you can actually raise your hand and, I mean, like actually raise it, right? Making sure you're all there, raise it, unmute yourself. Let us know in the chat that you have a question. I know this is a lot of information, a lot of updates. It's really exciting.
Sorry.
Hey,
You guys
Tabitha.
talk a lot on the medical side, but I don't hear anything really on the dental portion of it. Does this include anything about dental on the OHP side?
Yeah, I can answer that. No, we didn't. There's no pieces specifically around dental in the waiver this time.
Okay.
Thank you, Tabitha. I do have a colleague who's collecting feedback on dental. So don't hesitate to, actually, I'm just going to make note of your name and I will reach out to you directly and I can connect you to them if you'd like. And we can look at some of the different barriers you might be troubleshooting and make sure we're brainstorming with you.
Yeah, I definitely want to bring up, thanks for that, Ruby. And we want to hear your feedback. For the what's included in the waiver are things that we need to have special rule, be allowed to not follow federal rules. There's lots that we can do within our own system to improve dental and to work, you know, like what's called the state plan amendment. Those are things that can happen. We can also put things in CCO contracts. We can also, you know, work in our internal processes and benefits. So there's lots that can be done. So we'd love to get the feedback and then through Ruby and definitely want to hear about it. So thanks for that.
Okay, other questions?
Ruby, yes, there are a few questions in the chat box.
Okay, let me see if I'm not skipping through anything. Someone's taking
one about asking whether the slideshow would be emailed.
Yes, we will follow up with the slideshow and a YouTube video so you can go back and listen in.
Yes, and Juanita also asked, is the update complete if we don't have a question at this time?
Well, it's definitely, if you can't think of any questions right now, don't hesitate to reach out to us after the meeting. For now, these are all the updates we have for you. And so if you don't have any other questions, you're free to go, and just know we will be following up with an email and inviting you to our next meeting, hopefully in October. We'll have more news about what's been approved and then the direction that we're, you know, we can actually solidify some things and get a real, you know, more robust update for you. Okay, Lori, there's a lot of thank yous in here.
I was looking, I'm glad it was helpful.
Yes, yes, this is great. Okay, so we will stay on for, you know, another 5 minutes in case you can think of any questions. And for those of you who feel like you have updates you need for today, have a great afternoon. Thank you so much for joining us. We know a lot of you have a lot on your plates, whether it's juggling childcare or, dealing with, all sorts of things at work and crisis situations and caregiving. So we really appreciate the time that you take to reach out and say, we want to meet with you again. We want to hear an update. What's going on? But thank you so much for doing that.
Yeah, thank you.